Okay. So next question जो है I think अपने already उसका answer कर दिया, but still I'll ask for my subscribers. What role does a father can or should play to this journey of motherhood?
See, like she said, I think I've already covered it because see that inclusiveness things which I said. Like if a father is able to place the child over himself, then he's at par with the mother. And if
Yeah.
you think that is not there, and the priority is not the child, then I mean there is no point then talking.
Yeah.
I mean, not always. Sometimes both of if everybody is prioritizing the child and nobody is working,
Then
then
how
even
will the
that does not
house run?
work.
Yeah.
But then I think it is more about communication and chalo today I'm there for the child, tomorrow you're there for
It's
the
about
child.
balance.
Yes,
Yeah.
and you cannot take for granted every time. Okay, I am going to do my work all the time, and you are being the mother. You have to leave everything and be with the child. I think it is the same. Like you don't have to leave your job or anything just because you are the mother.
बट आज इतने 21st सेंचुरी चल रही है, लेकिन आज भी लोगों की मेंटालिटी यही है कि अगर एक लड़की माँ बन गई है तो उसे सब छोड़ छाड़ के काम वाम छोड़ के बच्चे के ऊपर फोकस करना चाहिए, अपना काम सब छोड़ देना चाहिए, एंड शी हैज टू बी एट होम विद द चाइल्ड.
That is exactly what fathers should not be doing. They now there is paternity leave, है ना. So but लोगों को like paternity leave, काफी लोगों को शर्म आती है paternity leave लूँ मैं. Why not? You have to. You have to.
Yeah, right. A question from my side, last question from my side. Single mothers and their journey is a lot more tough, I feel so. So how do they manage it all? What do you think?
I feel being a single mother, the decision of being a single mother itself is the bravest of all. People who are not brave enough hold on in that marriage or in that relationship just because they are not brave enough to let go. So just being a single parent or a single mother, it's in itself that decision is the bravest. अगर वो हो गया तो आगे का तो I think is simple. I think one of my favorite actors, Neena Gupta,
Yeah.
she has talked about this very nicely, raised up her child
Yeah.
alone and all that. So I think she has told, it was a difficult decision, I think back in the 80s or 90s, to raise that
Yeah,
child
that
alone.
time, yeah.
But she says she was always at every point, truthful to the child. She never lied to the child. She always said things, as it is. Ye aisa hai beta, and your father is this and this and this, and things are this way because of so and so reasons. So that the child was not bombarded 90 wrong things from
Exactly.
all around. And she also says about how parents who were initially against the whole thing became her strongest pillars later. So always when the father is unavailable, I feel there is somebody else who pitches in, maybe the grandfather or the mama or somebody is there, to fill that void. There is somebody who fills in that void so that bacha, that father figure ko miss nahi kare. And a lot of talking is done about the co-parenting also nowadays. But according to me, co-parenting should be done only if it is going to be positive. Some people, if they are abusive or abusive people, I don't think co-parenting should be done. Like abroad, I've heard stories. There are rules that 3 days the child is going to be with the mother, 3 days with the father, and the father is probably an extremely abusive person or vice versa. But according to the rule, the child has to go, whether the child likes or not.
Likes or
Luckily,
not,
in
yeah.
India, it's not that way.
Yeah.
We have the liberty to, look where the child is comfortable or not.
Yeah, right.
But yes, co-parenting is a nice thing, even for single mothers. It is.
But you think it's a nice thing, co-parenting?
See, that's what I'm saying. If it is positive in any way, or it is having some positive impact on the child, then why not? But
if the parents are friendly after the divorce and everything.
Not just about the parents, it is about what the child gets from the other partner also.
Yeah.
जैसे अभी वो बच्चे को फादर से कुछ एक्स्ट्रा मिल रहा है और the child is showing some positive attitude towards the father, then why not?
Yeah, okay. So मेरे questions complete हो चुके हैं. अब हम start कर रहे हैं. हमारे जो subscriber ने इतने सारे सवाल आपके लिए पूछे, तो उनमें से मैंने कुछ सवाल pick किए.
Yeah.
तो let's start with them.
Yeah, sure.
So चांदनी पटेल पूछती हैं, Hi Charu, I love your vlogs. You are super strong women. Thank you. Without anyone's help, you live your life your own way. I'm Chandni from Georgia. Okay. My question is, my son Arith is late talker. That time I was so worried, and my friend told me that might be he had autism. But when he was 3 years old, he spoke everything. But now my concern is he's very hyperactive and he is 5 year old now. When will he calm and concentrate on his work?
So hi Chandni. First of all, regarding your son, we have a clear-cut. We have clear-cut instructions, or we have clear-cut guidelines on what is to be done when. Like, when are we to be worried about, a language or fine motor or gross motor skills, when a child is supposed to walk or when not. So you say your child spoke everything at 3 years. So here, say basically a 1 year old might say just 2 words, a 15 or 18 month would say 3 4 words, a 2 year old child may have a vocabulary of 10 words, or maybe 2 word phrases like give me or take this, like that. A 3 year old child speaks a full sentence, like mujhe wo chahiye, ya I want to go there, or simple phrases. So if you say your child talked everything at 3 years, or a whole sentence at 3 years, I think that is fair enough. Now about the hyperactivity part, that I think it is a very subtle thing. Hyperactive syndromes and all that, I think you have to check it up with a developmental pediatrician. We have nice assessment forms and all that. So assess your child well, rather than guessing that this is this or waiting it to calm down. As if everything is normal, you are cool with it. If something needs to be done, then the earlier the better.
But when a child is active, isn't it a good thing?
She is saying hyperactive. So hyperactive,
Okay.
Charu, like for example, in this clinic, many children come in.
Yeah.
So a hyperactive child, usually children come into the doctor's clinic, they are little apprehensive. Oh, doctor is going to, like how Ziana is. She comes in, she knows, okay,
Okay, हाँ.
maybe a vaccine, or I don't know what is wrong, and they have a little confused. But a hyperactive child comes in, he is not bothered. You are a doctor, he'll come, take this, he'll be taking a toy from there, climbing on the chair, jumping here, climbing on the bed, coming, sitting on my lap. So that is hyperactivity.
Okay.
Being active and hyperactive are two things. There's a very, you really cannot draw a line, but yes, we have good assessment forms and everything.
Okay.
So we can rate a child and then decide whether anything needs to be done, counseling is to be done, or medications are required. So there are various grades. Like you said, autism is not just a single disease, it's a autistic spectrum. So there is like very mild autistic traits and severe autism. So it is all to be assessed at a doctor's place and then decided upon.
Okay. So, next question is from Shraddha Tuladhar. उनका पूछना है कि can we give pacifier to baby? Does it have any kind of side effect like delay in teething and all, teething and all? And how long can we give it?
Hi Shraddha. So a pacifier, I think it's very commonly used in the Western countries, but in India, I think, including me, all pediatricians say a blunt no. But here I would want to explain a bit regarding this. A pacifier basically is a nipple shaped, a food grade polymer.
know,
It is just
yes.
so what it does is, some children, even after, they are full, they have their feed, breastfeeding or any feed for that matter, they still, the sucking just suits them. So what the pacifier does is, it just, gives that little soothing effect to them. Some children, if they don't get hold of the pacifier, they use their thumb. So it is an thumb sucking is the alternate. So if you really want to, stop thumb sucking, or maybe your child is, you want to soothe the child in really, maybe you're in a place where the child has to keep quiet and all that, I think it is permissible. Coming to the cons of it, there are a lot. First of all, in a developing country like India, the hygiene is very important. People who are educated, if you say yes to pacifier, tomorrow the crore, I don't know what is the population of India, if crore people start using the pacifier, I'm very sure millions or lakhs of them will fall ill with diarrhea or anything. Because the hygiene, everybody cannot maintain the hygiene. The pacifier is down there on a dirty place, again you are putting it to the child.
Yeah.
Diarrhea. And then from the continuous sucking itself, the pressure in the ear might change. They are more prone for middle ear infections and all that. Regarding the teeth, see, there won't be any problem with the teeth eruption or the teeth. There's no development in the teeth formation, but yes, the alignment might differ. The whole oral cavity, the shape of it might change from continuous sucking. So there might be malaligned teeth and all that. So pacifier, I think, weighing the pros and cons, it is better to avoid.
Avoid, okay. So Anvi Alisa, she's asking, ask the pediatric what to do for severe motion sickness in kids. ये जियाना को भी है.
Okay. So motion sickness is basically when the child feels uneasy in a car or a bus or a flight, whenever there is a motion. So generally, in cars, I feel now all the cars are air conditioned and all that. Mostly, kids get suffocated with the air condition itself because it is a closed space. They are not getting the free flow of air. So the first things first, I feel the AC should be off and the windows should be open so that they get a free air. So that itself comforts a child. If it is a long journey, break the journey in between. The moment the child is uncomfortable, may take a break, get the child little fresh air and all that. Before a long journey, if you're anticipating a long journey the next day, give a small meal so that they don't throw up a lot.
Yes.
And yes, various home remedies like ginger or lemon, the smell of it can help.
Okay.
Other than that, one more thing is, sitting in the cars, many children look at the mobile or a book. So that sensory input, the more they are straining into looking something, the sickness is going to be there. हाँ, तो हमें बच्चे को distract रखना चाहिए. We have to talk to the child or play a game or something like that.
Okay. All right. So Farzana पूछ रही हैं, please ask the pediatrician about febrile seizures.
Yeah.
Okay, what are the things to be done and to be avoided? My son is 3 and he gets febrile seizures whenever he has high fever. What is that?
So a febrile seizure is basically, you might have heard कि when there is high fever, children get fits or convulsions.
Okay.
जैसे in very layman terms, people say बुखार सिर पे चढ़ गया था और आकड़ी आया था, है ना? So febrile seizure is basically, we have clear-cut definitions like 6-month-old to 6-year child. The age group is very particular, 6 month to 6 year. इसके बीच में अगर फीवर के दौरान किसी को भी कन्वल्शन आते हैं या फिट आते हैं, उसको फिब्राइल कन्वल्शन बोलते हैं. तो फिब्राइल कन्वल्शन बेसिकली मिर्गी नहीं है, जो एपिलेप्सी बोलते हैं वो नहीं है, खाली वो बुखार तेज होने की वजह से दैट दोज चिल्ड्रन गेट कन्वल्शंस. अगर ये 6 साल के बाद में होता है या 6 महीने के पहले होते हैं तो हम फिब्राइल कन्वल्शन नहीं कहेंगे उसको. This has a very strong family history also. Usually उनको सिबलिंग, अगर एक बच्चे को होते हैं तो दूसरा बच्चे को भी होने के चांसेस, या मम्मी को होते हैं तो बच्चे को होने का चांसेस रहता है. So basically ये अगर फिब्राइल कन्वल्शन है आपके बच्चे को, तो I think the doctor would have prescribed a medicine called Frisium. So that is a prophylactic medicine, यानी कि बच्चे को फीवर आते ही आपको वो मेडिसिन 3 दिन के लिए देनी है. उतना तेज चढ़ के कन्वल्शन आने के बाद एक्ट करने से बेटर है कि वो मेडिसिन, the moment your child gets fever, give that medicine. I'm sure your doctor would have prescribed it. वो मेडिसिन 3 दिन के लिए देना है ताकि वो चाहे कितने भी हाई फीवर क्यों ना हो, कन्वल्शन ना आए. और अगर समझो आ ही गया कन्वल्शन फॉर एनी मैटर, then you immediately place your child on the side में सुलाना है उसको ताकि वो froth and all that, they don't take it to the chest. You make your child lie down, and there is a spray also which comes. I think your doctor would have prescribed it to you. It is a midazolam spray. तो वो spray नाक में puff करने से तुरंत the convulsion will stop and the child will be comfortable. Then you can take your child to the hospital.
So दृष्टि पूछती हैं कि my baby's navel is outside and now she's 16 months and still doesn't go inside. When it will get normal, and is there anything to worry about?
Yeah, so basically a navel, the umbilical cord will fall by 2 weeks. 2 weeks के अंदर वो गिर जाते हैं, and after that the navel has to go inside. But many kids have protruding out navel. That is usually something called umbilical hernia. So it is a part of little bit of an intestine which is coming out through the navel part, which is normal unless the child is experiencing severe pain or is in fever. That is when the intestine gets stuck there. or we say it is a strangulated hernia. But other than that, you just give it time. I think it is usually more prominent when the child cries or strains at the toilet or something like that. So I think it is not to worry, it will go away on its own. But maybe after 2 or 3 years of age, if it is still there, just get it checked with the doctor if it is, you know, stuck there.
थैंक यू सो मच डॉक्टर, इट वाज रियली नाइस टॉकिंग टू यू. और मेरे बहुत सारे यू नो क्वेरीज थे जो आप लोग आपने बहुत ब्यूटीफुली एक्सप्लेन किए. आप सबके भी बहुत सारे क्वेश्चंस थे. प्लीज़ कमेंट डाउन एंड बताइए मैम को कि उन्होंने कितना ब्यूटीफुली आंसर्स किए आपके सवालों के, और आपके क्वेश्चंस आपको आंसर्स मिल गए कि नहीं मिले. Thank you so much, doctor, once again.
My pleasure. I'm extremely happy that you gave me the opportunity to do this. I mean, it was a wonderful experience for me too. I'm very happy I'm able to answer your. And I think I always wanted to talk about this to a lot of people. You know, जैसे लोग आते हैं क्लिनिक में तो many things are. This is a big platform. I'm reaching out to many parents.
Yeah.
Especially regarding, you know, the parenting and all. I always wanted to, you know, talk about this. कि
Right.
बहुत लोग को वो नॉलेज नहीं है. लोगों को लगता है, you know.
मैं बिल्कुल बोल रही हूँ ना कि बहुत सारे लोग व्हेन यू बिकम मदर, बहुत सारे लोग बहुत सारी चीज़ें लेकर आते हैं. तो ऑल राइट, थैंक यू सो मच मैम. बहुत शी इज़ रियली स्वीट. मैंने इनसे रिक्वेस्ट किया कि मैं इस तरह के कुछ आपके साथ एक इंटरव्यू करना चाहती हूँ. बहुत सारे लोगों के सवाल है, मेरे भी सवाल है, तो विल यू बी एबल टू डू इट? शी इज़ लाइक यस यस आई विल डू इट. शी इज़ रियली स्वीट दैट वे.
Most welcome.
Once again, happy Mother's Day.
Same to you. Same to everyone.